It's now my pleasure to introduce another member of the Hopkins team, Darrick May. He's going to talk about bad trips, examining bad trips, acute and enduring positive and negative consequences of challenging experiences with psilocybin. The bad trips in the title is in quotes, which is great. I always tell people there's no real bad trips, there's difficult trips. And as you'll probably say, people who have those experiences years later look back at them as actually quite valuable. I'm looking forward to hearing your talk, obviously. Darrick May, MD, is an addiction psychiatrist and postdoctoral research fellow at Johns Hopkins University. Under the primary mentorship of Roland Griffiths, PhD, Dr. May has been involved in the development of hallucinogen protocols, including a pilot study examining the potential antidepressant effects of psilocybin in people with treatment-resistant depression, and has been a study guide and physician monitor on multiple ongoing psilocybin studies. Dr. May completed psychiatric residency at the University of Washington and an addiction psychiatry fellowship at the University of New Mexico. While at University of New Mexico, he was a sub-investigator on a psilocybin for alcohol dependence trial being conducted by Michael Bogenschutz, MD, who's now at NYU. Additionally, Dr. May is a therapist, adherence rater, and completing therapist training for MAPS MDMA for PTSD studies. Please help me welcome Darrick.
Okay, thank you. All right, thanks, Neil. Yeah, today I'm going to be talking about bad trips, and Neil did steal a little bit of my thunder that I do consider bad trips to be a misnomer in most cases, and that these experiences can be considered more appropriately challenging experiences that are opportunities for growth. So most of what I'm going to be talking about today is survey data that was conducted by the Hopkins research team, and this was actually conducted prior to my time there, but I wanted to present this data because I think it's important that we talk openly about the risks of psychedelic use, and also from my experience guiding participants and my work in the Zendo and psychedelic harm reduction, I've seen a lot of people have experiences that look like they're having a really terrible time that would be considered a bad trip by some, but then later on hear them describe how personally meaningful and growthful the experience actually was. So as I'm presenting this survey data, I'm also going to be interleaving some of the principles that we use to reduce the risks in the research setting and also in the psychedelic harm reduction setting, where there's actually 4 principles of psychedelic harm reduction, and I'll be talking about those. First, I want to start with a definition of a bad trip. So this is a panic reaction that occurs in the acute drug administration setting. And kind of the epitome of it is fearfulness to the point of paranoid delusion. Now, I was thinking of making this talk experiential by trying to induce a panic reaction in you all, but I couldn't think of a way to do it, and it's probably unethical to do so. So instead, I'm just going to show you a picture of someone having a bad trip. Looks quite uncomfortable. So from epidemiology data, we really don't know how often these bad experiences happen. We do know that with classic hallucinogens like psilocybin or LSD, that medical emergencies are very rare. And there does seem to be some evidence that use of classic hallucinogens is actually protective of mental health problems. Likewise, in the research setting, we have not found that these challenging experiences lead to bad outcomes. In our dose effects study, when we gave a high dose of psilocybin, 30 milligrams per 70 kilograms, even though a third of the volunteers had marked periods of fear and anxiety, none of them went on to rate the experience to have as a decreasing their sense of well-being or life satisfaction. So because of these discrepancies in terms of the epidemiology data and our laboratory data, and this concept that in popular culture that bad trips occur with psychedelic use, that was a big reason that this study was conducted. And this online anonymous survey was published last year. Most of the authors are here and speaking today. A notable exception is the primary author, Teresa Carbonero, and I do want to thank her for letting me present this data. So we ask people in this survey to fill out the survey in reference to their worst bad trip. So their single most psychologically difficult or challenging experience. We asked them a whole host of questions about their set and setting, the dose, and then qualitative questions about the experience itself, many of which we ask of our research participants after their sessions. There were so many questions, in fact, that the median time to complete the survey was about an hour, and we think that this is a big reason that we had a high non-completion rate. We started with about 6,000 people entered the survey, but our final number was just below 2,000 people. So in terms of past hallucinogen use, most people were experienced hallucinogen users. Prior to their designated challenging experience, most people had used psilocybin in between 2 and 5 times, although some people, this was their first use of psilocybin or a classic hallucinogen, and the average age at the time of the experience was 23 years. In terms of mushroom dose, the average, for those people that knew their mushroom, the dose they took, the average dose was 4 grams. And so a common question is, how does this relate to the doses that we give of synthetic psilocybin, which we give in the lab? And using the average content of psilocybin in Psilocybe cubensis mushrooms, this is equivalent to about 20 to 25 milligrams of psilocybin, which, as Al was just talking about, this is going to be in the dose range of psilocybin when it becomes available as a medicine. In terms of the mindset that people went into this experience, a lot of people reported that they had a serious psychological or spiritual intention going into the experience, and that their emotional state was conducive to having a positive experience. So I think the take-home of this is that even if you go into the experience in the best possible mindset, you're not guaranteed to not have a challenging experience. It's not a protective factor. Likewise, the physical environment you're in is also not going to be an absolute protective factor from having a challenging experience. But what we do know from what people reported as helping during these experiences is that being in a comfortable, warm, calm environment can help people to manage being in or having a challenging experience once they're in that state. And the social setting is also an important aspect of the safe space. And this was a really interesting finding in the survey, in that what we consider to be an ideal guide or sitter in our research studies was really not present in very many of these situations. So the ideal characteristics that we think are having someone that's sober, trusted, and experienced with supporting psychedelic sessions, and that occurred in less than 3% of people that took this survey. So this supports the idea that a sitter is an important risk reduction strategy, and this is also a principle of psychedelic harm reduction, that you need to have a sitter present, and that sitter needs to sit and not try to guide the experience. So the sitter promotes feelings of trust and security by being a calm, meditative presence. And I like to think of this as the difference between healing with the head and healing with the heart. In therapy, in a clinical setting, we often try to make interventions that are intellectual, but really in a psychedelic, in a challenging experience or in a psychedelic session, we're really trying to remain present with the participant and connect with them on a deeper emotional level. We still do use the term guide in our research setting, but we really have the mentality of a sitter when we're in there in the session. We're not trying to be the experts and tell the people what the experience needs to be. We're letting their psyche guide the experience. So in terms of degree of difficulty, these were really challenging experiences for people. They were, over half rated this challenging experience as one of the top 10 most personally difficult or challenging experience of their life. And some of the correlations that we found with the degree of difficulty were higher dose, younger age, worse emotional state, absence of physical comfort and social support. These all make intuitive sense. Now, despite the level of difficulty that people were reporting, There was also a high degree of personal meaningfulness in the sessions. So this, again, supports the concept that difficult is not bad. Despite the fact that these are really difficult experiences, over half the people were reporting that these were among the top 10 most personally meaningful experiences of their life. And the top half of this graph also supports that difficult is bad. So 3/4 of the people reported that they had positive enduring changes in personal well-being or life satisfaction that they directly attributed to this challenging experience. So yeah, that supports the concept that difficult is not bad. However, the bottom part of the graph supports that there are true risks to psychedelic use. So just under 10% of people reported that they had decreases in their well-being or personal life satisfaction as a direct result of having this experience. So there's both risks and benefits to having these experiences. When we looked at some of the correlations, or when we looked at relationships between degree of difficulty and these positive attributions, we found that there was a direct relationship, meaning that the more challenging the experience, the more positive attributions that were given to that experience later on. And initially this is kind of counterintuitive, but if we think about these experiences as being emotionally cathartic experiences where we're working through some deeper issues, it makes sense that a more challenging experience would lead to more positive changes. Conversely, the duration of the experience was negative related to these positive attributions. So another way of saying that is that the longer the experience lasted, the less likely it was to be rated as a positive experience afterwards. So this has some therapeutic implications, which coincide with the fourth principle of psychedelic harm reduction, in that we're not trying to talk people out of their experience. We want to talk people through their experience. So we don't want to reduce the intensity of the experience, we want to reduce the duration. And our interventions are going to be aimed at that, aimed at helping people connect to what they are feeling, and that might mean that the experience gets more difficult in the short term, but often that leads to some resolution and can ultimately make the experience not last as long. This is what people reported were effective strategies to manage the experience. Trying to calm the mind by meditating or focusing on breath or using the body, changing the environment, seeking out support. So a lot of these are encompassed with the principles of psychedelic harm reduction. I do also want to note that cannabis use was frequently used to try to stop the experience, and half of people reported that it was helpful, but when we looked at the open-ended comments at the end of the survey, we found that some people reported that it significantly exacerbated the challenging experience. Now there's a lot of factors that go into that, but just wanted to mention that that's not a global recommendation to try. In terms of the acute adverse events that occurred during the experience, we found that the survey was consistent with case reports from the literature in that people were putting themselves and others at risk for physical harm and acting physically aggressive, and that some people even ended up needing medical attention in a hospital or emergency department. So again, this supports the concept that the risks are real to psilocybin and psychedelic research, and we need to be mindful of those risks. Likewise, there are risks in long-term psychological outcomes. 2/3 of the people that took this survey had their experience more than 1 year prior to taking the survey. And of those people, 10% reporting having enduring negative psychological symptoms. So this is pretty concerning. This isn't representative of how often these psychological symptoms or negative psychological symptoms occur in people that use psilocybin. I want to remind you that this was only people that had challenging experiences. So this number is obviously a lot higher than than people that are just out using psilocybin, or the values that we find in the lab, which are usually less than 1% of people having adverse psychological problems after the session. And the most common reasons people sought treatment were for fear, anxiety, and depression. So I've talked about some of the guidelines that we use in our sessions. Matt Johnson wrote this paper in 2008. I think he's going to talk about it a little bit later in his talk. I want to talk about the last 2 points, the preparation of volunteers and patients. I think one of the reasons that we have much lower rate of adverse events in our sessions is that we tell participants ahead of time that having an anxiety reaction is not uncommon, and we prepare them to deal with that if it arises by giving them the instruction that we want them to fully, to not run away from those feelings and those thoughts, and that we want them to really fully experience them and work through them rather than trying to avoid them. And just knowing that ahead of time allows people to remember that strategy when these situations come up. And then also the integrative sessions that we have so after the session. So if people do encounter challenging emotions or thoughts and they don't resolve during the session, we meet with them, or we can discuss these and help them integrate them and follow them up or refer them to care if they persist following the study. So one major limitation of this survey study is that we still can't estimate the prevalence of these experiences from this survey, because we were asking specifically about people that were having challenging experiences. We also don't know how truthful people were, because it was an anonymous survey. However, from the open-ended comments, we found that people were really taking time to fill out this survey and providing us really thoughtful responses. We did recruit through psychedelic-focused websites such as Arrowhead and Blue Light, so there was some selection bias there. And we also didn't address in more detail some of the longer persisting effects that people have, including hallucinogen persisting perception disorder. I want to briefly talk about the Challenging Experience Questionnaire, which Albert touched on. So this questionnaire was developed by Fred Barrett, who's speaking next, I believe. And it was developed using this survey data. And it was composed of items from 3 different scales that we administer regularly in our sessions. But these scales have over or near 300 questions, so we really wanted to cut these scales down and really focus on the meat of what is giving us important information about challenging experiences. So there's 26 items in the final questionnaire, and there was 7 factors identified. These 7 factors are fear, grief, physical distress, insanity, isolation, death, and paranoia. And so now that we have these 7 factors, we can administer this in all of our research sessions, and we can really find out in more detail what's going on in these challenging experiences, and then correlate the outcomes, whether they're therapeutic targets or negative consequences from use, and really figure out what elements of the challenging experience are leading to these longer term outcomes. So in conclusion, bad trips is a misnomer for many difficult psychedelic experiences, and I would encourage you to not use this term. Neil agrees. However, there are real risks to psychedelic and psilocybin use, including dangerous behavior and enduring psychological problems when psilocybin is used in uncontrolled settings. But these risks can be mitigated by using psychedelic harm reduction principles, and in the research and clinical settings with carefully screened, well-prepared participants and support during and after psilocybin sessions. And if we go ahead and use all these principles, then even though people are still going to have challenging experiences, there's a lot more likelihood that after the experience, they're going to end up having positive attributions to the experience as occurred in this case. So with that, I guess I made up some time here. So we're back on schedule, and I think I have time for some questions.
Thanks. As before, if you have some questions, you can just line up here in the aisle. So come on up, please, and give us your first name.
Thank you. My name's Melissa. Hello.
Hello.
I am here because of my interest in psychedelic harm reduction in my local community. And in that interest, I was wondering, of the participants that felt they put themselves or others in harm, were these the same participants that didn't have support during their experience? Or was there an even distribution across those that did and did not have a sitter?
Well, we found that difficulty of experience was the people that didn't have a positive social support, not necessarily a sitter, but their environment wasn't, their social environment wasn't conducive to having a positive experience, had a more difficult experience. But we didn't find a correlation between actually having the sitter present or not.
Thank you.
Hi, I'm Elizabeth. Thank you. It's good to be here. Dr. Martin Ball has suggested that in terms of bringing oneself back to physically safe space, to get the body into a symmetrical position, if there's a difficult experience going on, helps one do that. Have you seen any evidence of that?
I have not seen any evidence, or even I hadn't even heard that before. I think that there's so many questions we can study, and so many things we can learn about how to best manage these psychedelic experiences, including the challenging portions of them, and that's just another element that we could study. So thanks for bringing that up. Yeah.
Happy to.
Hi, my name's B. I was a bit surprised to see how low the numbers were for how many people had an experienced sitter whom they trusted present. And I'm wondering what you think might be the obstacles to people doing that. And I don't know if there's any research into that specifically, and perhaps ways to increase that in the general public.
Well, I want to make the point that there might be a lot more people that are using sitters with all of the ideal characteristics that we use in the research setting, but that those participants might not be having challenging experiences to the point that they filled out our survey.
Thank you.
Thank you very much. Please help me thank our speaker today. We're going to take our break.